Welcome to the Protecting Your Nest podcast. Today's episode will be a little different. I won't have a guest today because I felt it was important to spend some time talking about the importance of healing from hypertension and diabetes. I really think that's important because so many people suffer from these chronic medical conditions, and we must understand that they're both reversible if you choose the right diet. And the things I've learned in my obesity training, my training with nutrition and functional medicine has prepared me to see things through a different lens. So I'm really excited to provide an episode of the podcast where it's just me and you. And hopefully the things I share today will help you understand that, yes, you can get off your insulin. Yes, you can get off your blood pressure medicines. You just have to heal metabolically. And we'll walk through that for sure. So if you want to see some of the resources I have, I want you to go to Linktree, Dr. Tony Hampton, and you'll find all of those links, including videos. One of the videos that's very helpful is the one where I talk about how to adopt a low carb diet. So I encourage you to check that out. And I also have a video entitled Why to Adopt a Low Carb Diet. I think that's going to be very helpful as well. So let's think about what we're going to talk about today. The first is the hierarchy of research studies. I want to explain which ones are more important to pay attention to and which ones you have to, be a little bit more cautious about. I also want to talk about what's the best diet for reversing diabetes and hypertension, as well as how to heal from diabetes and hypertension. And we'll kind of wrap up our conversation today with resources that I think will be helpful as you start your journey. So, one of the things you want to ask yourself is, what's your why? Why do you want to heal? Why do you want to be healthy? And I think you want to really dive a little deep as you ponder that question, because if you have a strong why, it's going to keep you focused on achieving your goal. It's going to give you a reason to wake up every morning. It's going to give you a reason to do all the things that we discuss in today's episode. So let me give you a couple of examples of some whys I have. I have patients who come to me whose kidney function starts to deteriorate because of their diets and other factors, maybe uncontrolled blood pressure, uncontrolled diabetes. And it is so exciting when I get a patient in front of me whose blood urine microalbumin, which is, measuring the microscopic protein in their urine, when it starts to decline. I've had patients who have started as high as 3,000 microalbumin, and it goes down to goal, which is under 30, which is pretty amazing. And I just want to emphasize that's possible. And before I started this journey with carb restriction, I never saw patients' kidney functions improve. I've also had patients come to me who have diabetes, and maybe they've been on insulin for a while. I've had patients on insulin for 11 years. I have a previous podcast guest, Gwendolyn Butler, who shared that she had been on insulin for 11 years. And then only after adopting a low-carb diet, within 30 to 45 days or so, she was able to get off insulin. This is very possible, and it is an amazing thing to behold when you see it happening to your patients. Many people also suffer from hypertension. And of course, no matter how hard you try with medications, it's very difficult to reverse hypertension just with medications alone. But if you remove the inflammation from your body and become metabolically healthy, you'll find that that's a possibility as well. And of course, many people come to low carb because they want to lose weight. And I've seen patients lose 50, 100, 150 pounds and more by adopting a low carb diet. So I wanted to just let you know that that's my why. That's why I do this podcast. That's why I have a YouTube channel and write articles for the Diet Doctor and the other work I'm doing, because I believe that this is the way we heal. So let's talk about the hierarchy of research. And research is very critical because it gives us tangible evidence of what may or may not help us as we make decisions about our health. So So as you could imagine, some research that's not as, I would say, trustworthy is research that we do in test tubes with animals and things like that, or when you're just given an opinion about data. Those types of evidence are really at a lower level and not to be trusted. But then you move up the ladder to things like case reports, where maybe I see in my clinic, like those success stories that I just described, are things that I can say, well, these are anecdotal case reports that a doctor or a scientist could say. And then you get into cross-sectional and case control studies, and even a study called cohort studies. Those are starting to, go up the ladder of importance. And finally, you get to the types of studies that I like to rely on, which are randomized controlled trials. Those types of studies are more reliable, and the types of studies that we want to put more trust in. So that's kind of like the hierarchy. And of course, you can take any of these studies and do a systematic review and meta-analysis. But it's really important to understand that if you're doing that on studies that are of lower quality, then the analysis is of lower quality. So if you're going to really get to the highest level of evidence, you want to do systematic reviews and meta-analysis of randomized controlled trials. So I just want to kind of point that out, and just keep in mind that those case control cohorts and cross-sectional studies, they're all really like observational. And what that means is that in some cases, they send surveys to the people in the study, and they ask them questions and they send the responses back. Sometimes they'll look at data in a computer prospectively into the future or retrospectively into the past, and then they'll give an observation based on what they see. But a better way to do this is to do an experimental study. Experimental because we actually control for things like, are they smokers? Do they exercise? Are they drinkers? And we also know exactly what they ate for the most part, and we get a direct idea of what they actually did. So that's a better way to do it, as opposed to relying on somebody's memory doing a survey. So that's why an experimental model is the model we want to choose. An example of a cohort study was a study that was published in The Lancet, and it was entitled Dietary Carbohydrate Intake and Mortality, a prospective cohort study and meta-analysis. And again, you take a group of patients and you follow them into the future. And then, and once you do that, you'll then analyze the data. The key is that although a cohort study is towards the top of the pyramid in terms of the strength of the evidence, it's not a randomized controlled trial. So in this particular study, what they found is that a low-carb diet from animals had a higher mortality than a low-carb diet from plants. And so that would make you pause if you're a low-carber until you realize that this cohort study was simply a study that followed people 45 to 64 years of age, and they basically just sent them a survey and then asked them to complete the survey based on their memory. So although that's not a bad way to go, it's more affordable. It's not a bad way to do research if that's all you can do, but it's not at the level of evidence of a randomized controlled trial. Now let's imagine another study that was published, and it was entitled The Low Carbohydrate Diet and Cardiovascular Risk Factors, the Evidence from Epidemiological Studies. And this study was published in Nutrition, Metabolic, Cardiovascular Disease. So now the cool thing about this study is that it was a randomized controlled trial. And what they found is that a low-carb diet not only decrease weight, but also improve cardiovascular risk factors. So the question is, what do you do when you have two different types of studies that are kind of saying different things? And what I would ask that you do is that whenever you hear something in the media or from another doctor like myself, always ask yourself, was it a randomized controlled trial or was it a observational trial where they use things like food frequency questionnaires and things of that nature? If you have the ability to have a randomized controlled trial in front of you, it would be my advice to use that as the real study to follow and use the other study as more of a curiosity. That's interesting. Maybe we should do more research, but it's not A equals B. It's not a conclusion that you can make. And so I just wanted to kind of get that out there, because I think if we don't understand how to look at these studies, you'll continue to be confused. And that's why I want to talk a little bit about, well, what's the best diet for diabetes and hypertension? And of course, we're going to contrast a low carb diet with a low fat diet. When I think low carb, I'm also thinking keto and carnivore. And when I think low fat, I'm thinking vegetarian and vegan. So what I want you to understand is that when you look at the studies that have been done, there have been a ton of studies done that actually allow you to look at how effective a low carb and low fat diet were. And I'll make sure that you hear in simple terms what the data showed. And what it showed is that when it comes to significantly greater weight loss, the low carb diets were 36 and the low fat diets were 0. So in other words, there was 0 low fat studies that were randomized controlled trials that actually gave better results when it comes to significant greater weight loss. Now, when it comes to greater weight loss, it was 58 low carb and 7 low fat. So the point is that we want to emphasize that it is definitely okay to do either. And I'm going to tell you why. Because when you look at these studies, they show that both the low carb and the low fat diet actually improve the things that we measure, rather it's the weight loss, blood pressure, blood sugar, etc. However, it is also easy to see from the data that the low carb diet is the clear winner. So the point I would make to anyone who hears my voice or watches this video on YouTube is it's okay to eat a low carb diet. So when you hear things out there that suggest that it's not healthy or it's dangerous, the science doesn't really support that. And I would hope we get to a point where we're all just focused on achieving metabolic health. And rather we do that with a low carb or a low fat diet, you do what works for your body. And the good news is that there are some folk coming out. The Journal of the American College of Cardiology, they did state that a limit on saturated fat, which you tend to see in low carb diets, is unnecessary. So there's no need to worry about saturated fat like we've been told for years. But interesting enough, they also said that the recommendation to limit dietary saturated fat intake has persisted despite mounting evidence to the contrary. So when you think about that, that's why I'm making this video today, because as of June 24, 2020, they've made this statement, but yet most clinicians have not changed how they practice, and they're still kind of in the method, the way of thinking that the low fat diet is the only diet to achieve metabolic health. So let's talk a little bit more about diabetes. And I think it's important to recognize that we're all going to be potentially impacted by diabetes, but you do tend to see communities of color more impacted, particularly the American Indian population. They have the highest rate of diabetes at about 15%. And then you have Hispanic at about 12.7 and African American at 12. And when you think about how the population is distributed, it seems to be a little lack of balance in terms of which communities are being affected. So when you think about what diet is best, we have some good news. The good news is that at the end of 2019, the American Diabetes Association finally made a statement that the diet that we're speaking of, a low carb or very low carb diet, is now part of their recommended eating patterns. They also include the Mediterranean, the vegetarian or vegan, of course, a low fat diet, and they include the DASH and the paleo diet. But finally, they're saying that it's okay to eat a low carb diet and a very low carb diet. So now for those who have to follow guidelines, they have a little bit more license. It's really important for our clinicians who will pause if they don't have guidelines, even though the science was clear. These studies that I shared with you a moment ago, some have been done as, years ago, and yet doctors didn't feel comfortable because they didn't have guidelines that would suggest it was okay to consider that. Thankfully, the previous president of the American Diabetes Association, and that's Tracy Brown, was able to speak to how she used a low carb diet to reverse her diabetes. And at the time of the recording that she did with the Life in the Fasting Lane podcast, she was able to share that she got off of her insulin, which was really an important statement coming from somebody in that position. And she did have a transformational tenure, but I think that the biggest transformation will be if she continues to speak out and say, yes, this is a diet that you can trust. So now we have the Journal of the College of Cardiology saying saturated fat's not a problem. We also have the American Diabetes Association making a low carb diet one of their dietary options, and we also have the American Association of Clinical Endocrinology, who also made a statement that one of the recommended dietary patterns that you can consider is a low carb diet. So that's really kind of cool to see. Now I want to speak a little bit about type 2 diabetes and what that really is. Many people think about diabetes as a high glucose problem. Well, the reality is it's really about insulin resistance. I think it's more about that than anything. So if you think about, well, what does that mean? Well, if I eat a high carb diet, and that diet will then lead to a lot of glucose in my blood, that's going to make my body have a high demand for insulin. And when I have a high demand for insulin, which is made in your pancreas by your islet cells, that's going to then potentially, over time, make your pancreas work too hard and potentially stop making insulin as well. Initially, your pancreas is going to rev up the machinery and make more insulin. But again, if you make it work too hard, it's going to then make the insulin not work as well. And then that'll lead to the receptors in your cells saying, I don't know if I want all that glucose in me because, you're pushing too much in. So it becomes resistant and makes it very difficult to get that glucose into your cells via the support of insulin. So imagine what that does. It's almost like you're eating and you're not really getting nutrition because you can't put the glucose into your cells. So instead you urinate it out, or maybe you store it as fat. But at the end of the day, your body really feels like you're not getting nutrition. So your body will feel like it's starving. So it's going to make you hungry. And then you start the cycle all over again. And because of all of this insulin at a high level causing inflammation, and because there's all this glucose around causing inflammation, you're going to develop a ton of health problems because of that. So what happens when you get insulin resistance? Well, you may have seen it on a family member or somebody in a community. And you may notice that some people get these dark rashes on their skin. And that the name for that is acanthosis nigricans. And so if you see a dark rash on the skin and they don't have anything like eczema or any other explanation, it could be a sign of insulin resistance. Another thing that we think about with insulin resistance are the same things we think about for metabolic syndrome. That includes things like a waist circumference that's higher than it should be, high triglycerides in your blood, low HDL, which is also considered the good cholesterol, a high blood pressure, and of course a high blood sugar. Those are all part of metabolic syndrome, and of course insulin resistance leads to metabolic syndrome, and we'll talk a little bit more about that in a moment. So we're kind of getting our feet wet and trying to understand, what is this metabolic syndrome? What are we trying to talk about? And we're going to keep our journey moving along. And what's really cool is that the American Association of Clinical Endocrinology, they're really starting to understand that we need to think about diabetes early on. So instead of just focusing on treating people when they first get diagnosed, we're now at a point where we're looking for insulin resistance. So those signs I just showed you that also reflect metabolic syndrome, doctors are starting to be trained to look for that early on. And then, because we know that can lead to pre-diabetes, and then, of course, pre-diabetes can then lead to diabetes. So I'm really excited that I don't feel like we're out here on our own kind of preaching the gospel of carb restriction. Now we're starting to get organizations that influence the decisions of clinicians to start to chime in. One of the things that you can do as a patient or anyone who's listening to this episode is you can ask your doctor to give yourself a fasting insulin level. And it would be a good test to do because it's very predictive of what may happen in the future. There is a calculation called the HOMA-IR, homeostatic method assessment of insulin resistance test. And that test can give you a feel for, are you at risk for developing, insulin resistance and or diabetes? What's interesting is that why this test is effective is because you get that insulin resistance early on. And because your body is such a phenomenal machine, it'll actually keep your blood sugar at a normal level. It may rev up that insulin production and keep your sugar at a normal level. So if you're just getting your blood sugar checked or your A1C checked, you may not know that there's a problem. So what we want to do is check an insulin level in the beginning, and then you'll be able to know up front. And the value of doing that is that now you have a reason to make those lifestyle changes that maybe you were kind of not making right away because you didn't think you were at risk. But this will kind of let you know what, this is really happening and I need to do something about it. So what do you do? It's really about protecting your nest, right? So some of it is, exercise. We want to shrink our belly because I think of all the things we look at, your belly is the biggest risk factor, or the thing that you'll know is saying, okay, I'm in trouble and I may have this problem. People who smoke need to stop smoking, of course, and we need to reduce our carb intake, whether it's from sugar or starch or even excessive grains, and we need to get enough sleep and reduce stress. A lot of people, and people like Dr. Jason Fong has taught us that we need to consider fasting, because when you fast, you rest your pancreas in a pretty significant fashion. We also need to be mindful that although your doctor may recommend metformin, which is okay, the reduction in your risk for progressing from borderline diabetes to diabetes is about 31% reduction with metformin. But the good news is that when they do studies, they find that it's a 58% reduction using lifestyle. Even better, if you're over 65, the studies show that it's a 71% reduction in you progressing to diabetes. Now, if you think about that, why would I use a medicine at 31% reduction when I can use a lifestyle change, which is either going to be 58 or 71%? So I just want to emphasize, when you're thinking about insulin resistance, the treatment should be lifestyle before anything else. Now, when it comes to hypertension, it's really important to understand that that's also caused by insulin resistance as well. And it's a pretty interesting thing to think about. So let's think about why that's true. So if I overconsume food, like the example I gave with the diabetic, if I'm genetically predisposed, or even ironically, if I consume a lot of insulin, even if it's from medicine, right? That will lead to hyperinsulinemia, and that can do a lot of different things. Like, for example, it can increase the influx of calcium into your smooth muscle. And if you think about it, some people take calcium channel blockers to reduce their blood pressure. So you want to do the opposite of what hyperinsulinemia is doing. Another thing that can happen with hyperinsulinemia is you can get absorption of sodium in your kidneys. So I always tell patients when I'm talking to them about carbs, I say carbohydrates attract water. It's got hydrate in the word. wherever water goes, you may find the salt will follow. So if you eat a lot of starchy, sugary foods or too many grains, you may find yourself holding on to too much sodium. Too much insulin is inflammatory, and it causes inflammation. So you can get endothelial dysfunction. That's the lining that covers your blood vessels. And an excessive amount of macrophages can also show up, which can create problems. And then the hyperinsulinemia, again, too much insulin, just like that person that drinks too much alcohol. If he drinks too much alcohol, he or she, he may find himself tolerant of alcohol and resistant to alcohol. So too much insulin does the same thing. You become resistant. And when that happens, your endothelial nitric oxide and nitroglycerin, as you know, is something that opens up your blood vessels. So if you don't make that, because of all the inflammation in your arteries, you may get vasoconstriction or constriction. Now, all of this will lead to hypertension, and all that inflammation can then result in clogging of your arteries. And it's really important you understand that we don't want that. And another example of what happens is the inflammation leads to the cholesterol trying to repair the artery. And the repair process goes overboard. And instead of tuck pointing your house, you stucco your house. And that's the equivalent of saying you stucco your arteries, but you're stuccoing it with the cholesterol deposits, which can then lead to clogged arteries, leading to a heart attack. Insulin resistance can lead to metabolic syndrome. And the thing that's interesting about metabolic syndrome is that even though this discussion is focused on hypertension and diabetes, metabolic syndrome is the thing that is related to cancer. Interesting enough, too much sugar in your diet, too many carbs can cause inflammation. And truth be told, cancer cells, by a principle called the Warburg effect, many cancer cells prefer to use glucose as their fuel. So people who have too much glucose being formed from their sugars, their carbs, and their grains have a higher risk of many cancers that we worry about. You already know that dementia is called type 3 diabetes. And if you hadn't heard that term, that should tell you a lot about the fact that metabolic syndrome is also a big risk factor for dementia. And of course, stroke, heart attacks, hypertension, and diabetes. And there's many more. But the point of this is that if you fix metabolic syndrome, you may be fixing 70 to 80% of all the chronic medical conditions that plague society. So this should be breaking news on CNN. And if we only adopt these dietary changes that we're talking about today, that'll be the key. So let's talk a little bit about what do we do? When we are faced with metabolic syndrome, we're concerned maybe our waist circumference is over 40 inches as a male or 35 as a female. Of course, those numbers are different for folk who are from the Asian community. But just let's say you fit that, or your blood pressure is high, you're diabetic, and you have maybe 3 of those 5 criteria. Your triglycerides are high, your HDL is too low. What do you do? Well, that's why I came up with the Protecting Your Nest podcast, because these are the root causes of all the things that make us sick. And so we want to think about our nutrition, which is the low carb diet. And I mentioned intermittent fasting earlier. We want to exercise, reduce stress, get enough sleep. If we've had trauma, we want to recover from trauma. Positive thinking is helpful because negative thinking is stressful and doesn't really serve us. We want to be in positive relationships, avoid organisms that can harm us, obviously avoid pollutants that can harm us, protect our emotions, and our life experiences must serve us. So if you have things from the past that will encourage you to do things that are not as helpful, you may want to consider doing something different and learning from your life experiences, but don't let those life experiences determine how you live. So I really am excited to continue to educate you that your labels are critical, right? So you have to have labels that serve you. And I was once a net carb guy. So I would tell patients to look at labels and calculate their net carbs, which is taking the carbohydrates, subtracting the fiber or the sugar alcohols, and then coming up with a net carb number. I have found that for many people, it's better to do total carbs. So rather you're trying to reduce your carbs to 50 per day or 20 per day, depending on how fast you want to reverse metabolic disease. Get in the habit of looking at those labels and making sure that you know what you're eating. The good news is when I encourage people to eat a diet that's carb restricted, I actually encourage them to eat most of their food based on what's on the outside of the grocery store. In other words, the animals and the vegetables, and of course the berries. Not a lot of fruit, but the berries if you're going to eat fruit. I tell them to focus in that area so they don't have to really read labels that often, because those labels are suggesting that you're eating something that's more processed. It's also important to remind people that the amount of sugar in your blood is only 5 grams, which is only like a teaspoon of sugar. So imagine eating a serving of brown rice, which is about 45 carbs, divided by 4 is 11 teaspoons of sugar. Imagine what that does to your body when you go from what it wants to have your sugar level at 5 grams, and then you dump, instead of 1 teaspoon of sugar in your blood, you're going to dump 11. And you could imagine that the body may perceive that as toxic, and it's going to do everything within its powers to lower the number back down to where it should be. And I love, the graphs that are out there that help us, like the Unwins, who are on the other side of the ocean. The Unwins make these great graphs, Jen and Dave Unwin, that help us to understand what's in our food. And if I were to look at a graph that has maybe raisins, for example, a serving of raisins, you may see an equivalent of multiples of teaspoons of sugar. So if we ate things like that and knew that, then maybe we wouldn't eat those things as often. A banana, for example, could be anywhere from 6 to 7 teaspoons of sugar, because you take the 28 carbs and you divide it by 4. So get in the habit as you consume food of thinking about what's the total. When I take that carb number divided by 4, that's going to really help you understand what you're consuming. So one thing that really changed my life when I started my dietary approach to stay healthy, I was blessed not to have diabetes or hypertension, but just to live well, was intermittent fasting. So I personally eat from 12 to 8. That's my eating window. I have patients who only eat between like maybe 4 and 8 or 3 and 7. That's more of a warrior fast. But at the end of the day, I think it's nice to know that if I do intermittent fasting, I can also reverse metabolic dysfunction fairly quickly. And it's really important that we take advantage of an opportunity to do that if that's good for me. Now, if you don't want to fast, that's okay. But it's important that you know that that's an option, and it's an option that you should take advantage of if you choose to. It's clearly the fastest way to reverse diabetes and to heal those arteries for hypertension. But you got to be careful, because when you're not eating and you're taking medicine, you need to have a way to wean off medicine. So make sure you work with a clinician. Let them know what you're doing if you choose to take that approach, so that you can do it safely. It's important that we be careful about guidelines that are out there. And I mentioned guidelines earlier, and that clinicians are kind of married to that. And if you think about the old food pyramid, you would see a lot of, cereals and breads and potatoes and pastas and rice as the foundation, and multiples of servings per day were recommended. And what I'm suggesting is that those types of foods will not serve you well if you are trying to heal from metabolic disease. So again, there are times when we have to make decisions. And, we're going to talk to our clinicians, make sure you get advice. This is informational. It's not medical advice. But I tell you, if you want to do an experiment, eat some potatoes and 2 hours later, check your blood. Take in a banana, and 2 hours later, you eat the banana. You'll learn very quickly that those types of foods will raise your blood sugar. And a logical approach would be not to consume the things that are raising your blood sugar. I also tell patients that the oils that you consume matter. So when you think about the so-called bad fats, they tend to be fats that are from seeds. So things like canola oil, corn oil, things like that, margarines, those tend to be bad fats because they have to be processed in a way that turns a seed into a oil, highly processed, highly refined. And when you do those types of things, there's a lot of inflammation that results from it. There are definitely some good fats. I always tell patients boca, butter, olive oil, coconut oil, avocado oil. Those are good fats that your body doesn't mind because they don't have inflammation. Because if you cold press an olive, the oil just kind of comes out. It doesn't have to be highly processed. Therefore, it's more of a natural oil. So as you move away from those seed oils, I want you to move towards the less inflammatory natural oils. The Diet Doctor has some really cool graphs that help us understand what we should be eating. We always joke with our patients that they should eat above ground vegetables if they want to stay above ground. And those are things like cauliflower, cabbage, zucchini, kale, Brussels sprouts, spinach, things like that. In other words, you want to eat vegetables that have a low glycemic index, meaning they have a low carb count and they don't raise your sugar much. And then you have starchier items that you want to avoid, those below ground vegetables like carrots, onions, and you can do onions in moderation. Potatoes, whether they're sweet or regular white potatoes. You want to kind of avoid those because they're very starchy. And of course, the rice, pasta, potatoes, cornbread, things like that, you have to really be careful with. So when you're making these changes and you're trying to heal from diabetes and hypertension, it's really important that you keep your life simple. I'm actually recording this on a Sunday, and I have two big pans of chicken baking as I am recording, and what I try to do is have enough food for 3 days, and then you can have 1 or 2 non-starchy sides, and the key is cook for volume. The process I teach my patients is 3 days worth of food Sunday. Of course, if you have a large family, maybe won't be able to do that. And then on Wednesdays and Fridays, we cook for 2 days. So that means I'm only cooking 3 days a week. And it just makes it a little bit more doable. And I know it's hard. People are busy. They're working. They're going to the kids' basketball game after school. I get it. But, throwing stuff in the oven makes it pretty easy. So imagine having some Brussels sprouts, some yellow squash, and some baked or air fried chicken, or all on a plate. Plate's not going to have a lot of carbs. Imagine having some spinach, mashed cauliflower instead of mashed potatoes, and maybe some your favorite fish. Or imagine having a steak with some broccoli. You can have some butter, and maybe have some creamed spinach as well. Very, very tasty. Maybe you have, and this is the interesting thing, if you have mac and cheese made of cauliflower and maybe some beans, you can still have beans. They're starchier, right? But if you have some beans, 24 carbs or so, the cauliflower mac and cheese is only 4, right? So now you're at 28 carbs, and you're going to have a fish that doesn't have cornmeal on it. Maybe you just blacken it with blackened seasoning. So you're still eating a dinner that's less than 30 carbs. And if you're eating twice a day like me, it'll be easy to stay under 50 with that approach. So I really love the fact that there's so many nice foods that you can eat. We even, I remember when I first started my low carb journey, we would make cauliflower crusted pizza, and I would use Parmesan cheese, cauliflower rice, and egg. That's what I would use. And then I would make a crust out of it. I've made some YouTube videos about that. It's delicious. And all you really had to change for the pizza was the crust. Of course, when I make a barbecue meal, I don't use the barbecue sauce. And if you have barbecue sauce in your home, just look at the label. You'll see fructose corn syrup as the first ingredient. You'll see molasses, and you may see pineapple juice and honey. You'll see sugar. You'll see cornstarch. You'll have 5 or 6 sources of sugar in the barbecue sauce. So if I use a low carb or keto rub instead, that's going to be a much better option for my family. And if you do a good job with that rub, whether you're smoking it or just putting a nice rub in the oven on your meat, it's going to be delicious. And it's really a wonderful way to prepare a meal. Sometimes we even go as far as we'll fry chicken we'll use the air fryer, or we'll fry the chicken with maybe avocado oil, coconut oil, and we won't use flour. So we're just simply avoiding the flour, and it'll still have a crust. It's just that it won't have a thick crust, but that's okay. And I do the same thing when I make salmon croquettes. I love cauliflower rice because I can make I can do a shrimp fried rice, or I can do another like shrimp dish on top of the rice. But I always use cauliflower rice because it has 4 carbs. And again, brown rice, as an example, has 45, and if you don't trust me on that, just Google it, and you'll be shocked when you see those numbers. And again, I love salmon croquettes. So when I fry salmon croquettes, I still have a crust, and I still get the effect that I'm looking for. My kids are really good for making desserts, so they'll make they'll use an alternative to sugar, an alternative to flour, and they'll make cheesecakes, and they taste as good as you could imagine. One of my favorite chocolate cakes comes from the Diet Doctor, and with that chocolate cake, we don't use flour, we don't use sugar. I know we use egg with the recipe, dark chocolate, vanilla flavor, and it's really a pretty nice, simple way to make a chocolate cake with a little whipped cream. And it's amazing that it tastes pretty good. So you'll be surprised at what you can achieve with a recipe. So I think it's important that as you start your journey and you want to heal metabolically, that you start to monitor how much water you drink. Water is really critical, obviously, to make sure you're not thirsty, but more important, sometimes you think your thirst is hunger. So you want to make sure you're drinking water so that you're not being confused about your hunger when it's really just thirst. So I tend to drink, the equivalent of a couple of glasses of water even before I get to work. I may have another glass or 2 before I start, and then I kind of start slowing down as the day progresses. But it's important to drink water. It's important to get your sleep, and it's important to monitor your carbs. So when you first start your journey, you may want to track your carbs. You may want to track your carbs so you can see how you're doing. So you want to really keep this very simple. You need an animal. If you're not a vegetarian, you need a couple of non-starchy sides. I tend to be more of a carnivore for lunch, so I'll eat some leftover steak, chicken, and I'll just eat that by itself. I skip breakfast most days, and then I have a sensible dinner with some animal and 1 or 2 non-starchy sides. It's really kind of easy to do this. You just have to create an environment in your home that keeps you safe from temptation. So there will be plenty of resources that you'll have with this episode. Of course, I'd like for you guys to go to my Dr. Tony Hampton, that's DR, link tree. And the link tree will have links to everything that you need to know. I do have a video that goes into a little bit more detail on how to adopt a low carb diet. I want you to check that out. And of course, the other things that I have out there, whether it's with the Diet Doctor, the columns, the monthly columns I write with them, I think that's very helpful to provide perspective, as well as the work we're doing with the Society of Metabolic Health Practitioners and other links, even to the Beyond Impossible documentary that Vinny graciously allowed me to provide commentary for. And of course, other things like the Protecting Your Nest podcast, which you're enjoying right now. So another pretty important handout is, what to eat, right? So you have one side of the handout that says foods to have. And then the opposite side of the handout are the things that you should avoid. So I just wanted to emphasize that. And I do want to applaud the Society of Metabolic Health Practitioners. I did record a video with them where we kind of walked through the website. I did that also for Low Carb USA, but I want you guys to look out for that. That video should be out in the next a week or so after this episode. And it's a very important place for you to, find a doctor in your area who understands metabolic health. They have a physician search portal in there. And just as importantly, they have the clinical guidelines. So let's just say you're really excited about what you're hearing today. You're like, you know what? This is 2022. This is my year. I'm going to do something different. Well, your doctor may not be as well versed. And so maybe printing and handing your clinician the clinical guidelines that say, if you're going to do carb restriction, this is how you do it. That was primarily written by Adele Height and others, and I really appreciate the work that she did to put that together. The Metabolic Multiplier is another website, metabolicmultiplier.org is another website I think that's very helpful. We'll make sure to have links in the show notes. And Cecil is the lady who kind of runs that, and she has been very supportive and is doing a wonderful job spreading the good news that metabolic health is possible and it's achievable. If you're looking for meal plans and you're not sure how to get started, the Diet Doctor has a wonderful meal planning tool that'll help you plan your meals, get grocery lists and things like that. And as you're getting started, that's probably a smart way to go. And some of my patients have taken advantage of that as well. And ultimately, what we're trying to do with this episode is to remind you that if you do the protecting your nest principles, you will not have chronic medical conditions as a general rule. You will heal if you're metabolically in metabolic dysfunction right now, and you will have an optimal life. In other words, you won't just sit around waiting for something bad to happen. You will be able to optimize your health. So I really want you guys to look at that nest and rope acronym and say, where do I have gaps? Where do I need to improve? And let's start getting to it now, because now is the time. Now is the time to work on those areas of your life that you've been waiting to work on. And this is the year. So today was interesting because we didn't have a guest. I just wanted to let you hear my voice. I wanted you to kind of level set and understand, okay, where am I at? What do I need to work on? We kind of focused on diabetes and hypertension, but as you have learned, it impacts cancer, it impacts dementia, and all these other things that we worry about. So you understand how to look at studies a little bit better. Randomized controlled trials are the way to go. You understand that diabetes and hypertension can be reversed, and you know how to heal. You're going to protect your nest to do that, and you have some additional resources. So anybody that follows me on YouTube with this podcast or elsewhere knows that it's all about thinking outside the box. I'm sometimes shocked that there's not more clinicians like myself who understand this information. I do not blame them, because again, they have to follow guidelines, right? And the guidelines in most cases are not evidence-based. Who would have thought, right? So it's really not the doc's fault. It's not the advanced practice clinician's fault. They're just trying to follow the rules that come with their profession, particularly our nutrition professionals. They have to follow the rules, and they're really not allowed to speak about keto and carnivore and things like that, because that's not part of how they're trained. So you being a follower of myself with the Protecting Your Nest podcast automatically puts you into a different category. You're a person who is not afraid to question conventional thinking. You're not afraid to think outside the box. And by doing that, you've learned that, if I understand why we get sick, the root cause of why we get sick, then maybe I can find a cleaner path to healing and not having the chronic conditions that maybe some of my relatives have had. Today, you've learned that diabetes is an insulin resistance problem. It's not a high sugar problem. It's a insulin resistance problem. And the same is true for hypertension. Now you understand that my hypertension is actually about too much insulin, and too much insulin is about too much starch, sugar, and grains in my diet. And you're going to take the principles of the Protecting Your Nest podcast, and you're going to apply those to all areas of your life so that you can be healthy. And what's really important, and I guess what I'll leave you with, is that it's so important that you walk away from this episode and you're ready to make a change. Because if you don't make a change, guys, somebody's going to get sick in your family, and that may be you. It's time for us to really make the change necessary to heal. Because if we do that today, for the rest of your life, and not just your life, I'm taking an epigenetics class right now, and shockingly, your genes are passed on, right? And what I'm saying is that if you acquire really good habits now, you will then pass on good habits to your next generation. And those genes that you're changing to be healthier will be the genes of the next generation. So you'll give them a head start by doing the right thing. So I hope this episode was helpful. I hope it added value to your life. And as we wrap up, until we have another episode, be safe, be well, and continue to protect your nest.